Hi, I'm Dr. Behnam, board certified dermatologist, and I practice in Los Angeles, California. Welcome to another stem cell hair restoration video. I practically pioneered stem cell hair restoration in the US back in 2016. We were one of the first groups to start using stem cells and adding it with PRP for better result and better effect. So I'm going to demonstrate another one of my patients. So this is another patient who came in. He's a young gentleman who was thinning quite a bit right here in the center, basically mid-scalp area, and he wanted to do something about it. He's a busy young gentleman, so he really didn't have the time to come in multiple times for many PRP sessions. So we decided to do PRP with stem cells. Please realize that stem cells come from another person, which is umbilical cord stem cells. Stem cells in the US are not FDA approved. They're used only for temporary improvements, and they're not a cure at all. So in this case, we did a 60 ml PRP and mixed it with a 30 million umbilical cord stem cell, and then we numbed the area and we injected. And this is about 6 months after. So this patient doesn't live in LA, so he had to come back to look at the photos. So we did it here, and then here's the photo afterwards. Now you're gonna say, well, the hair part is different, but actually I really did try to really part the hair, but he really has a lot of hair, so the hair doesn't part. So this area where he was thinning basically all grew out. Typically with stem cells, the results usually last about a year to year and a half, depending on the patient. After you do the stem cells, you could also do other medication as well, like topical minoxidil, topical finasteride, oral minoxidil, oral finasteride. And usually, what we have noticed is that when you use other medication after stem cell, it not only boosts the results, but also you're going to get more longevity from the stem cell procedure, which is once the hair grows out, the hair is more likely to remain there for a longer period of time. So he's a very happy gentleman who did stem cell, and that's it. Thank you so much for listening.